struggling, and we had some good and bad outcomes from COVID and the funding from COVID. So first off, the issue right now is cash flow. We're not taking in enough funding for the services we provide. That has to do with many things, but the key issue that happened, which is something we found out on June 30th, was Medicare sent us through the intermediary, which is a company called Iridian, information that they felt they had overpaid us for the prior year. So for July 1st, 2021 through June 30th of 2022, they estimated, their team, that they had overpaid the district $5.2 million. Now, we actually file an annual cost report so that our consultants can say this is what we should have been paid. It's always a look back, but the intermediary doesn't wait for that. They actually do their own estimate looking forward. So what effect did that have on us? Actually two, and it's in the minutes at our board meeting starting in July, is they started deducting funding from the district in July, starting on July 1st, to recoup the money they stated that they overpaid us for the previous year. In addition to that, they started paying less for the services we started to provide on July 1st. So in combination, $900,000 swing, taking funding from the previous year and shorting us on funding from the current year. Added up, that's $900,000, and that happened immediately in July. Now, we have gone, and I'm working with them, and we filed the cost report to settle with us. Another big, 20% of the Medicare payment is withheld from the district. Something else that happened last year, again, I mentioned we went back to 2020. So we went critical access March 26th of 2020. We did that not to lower the beds. We were only seeing for the previous 3 years, we were only seeing in the acute facility about 16 to 16 and a half patients per day in the acute facility. So it didn't make sense for us to continue that way because it wasn't making money. 25 access hospital, you're normally rural. We just happen to be in a location between San Jose and Monterey, but they realize you need more funding to continue care. So they're basically going to pay us the cost of care. And again, we only from March 26th of 2020 through June 30th of 2020, they had a 3-month window that they could look at us and go through our expenses. So within 6 months, they informed us, we think we owe you another $3 million. So we just set that aside, that not believing they owed us more money. So our first full year of a cost report was actually the fiscal year 2021. That point, we settled up with the government, but that year was the biggest year for COVID because December of 2020 through February of 2021 is when COVID hit the first year. We actually had a census in excess of 25 beds, at the highest 44 patients at the hospital. So we had a lot more costs associated with the care because people will remember for nursing, we brought in a lot of travelers for that time period. So that inflated the cost of our care by about $6 million for the year. Now come forward into 2022, as we're going through the cost for the district, that amount of registry is not there anymore. So that is the reason behind the overpayment that we're working through. But in addition to that, changing the cash flow from Medicare, some other big changes were during the early years of COVID, the government was sending us money. They expected that we would pay back. Some monies came free. You've heard of the CARES Act, or you've heard of ARP, American Rescue Plan. That's funding we have to reconcile with the government. But there was a fund called the Accelerated Payment Program for Medicare. So we didn't have funding in March. They sent us $6.9 million. That helped us through the tough time in 2020. But last year, they expected that money back. So what they did, just like they're doing now, they just started taking the funding away from our claims. So money they lent us 1 year, they're reducing the reimbursement for the year we're working in. Another loan we took during that crisis time was from Blue Shield, $2.85 million. Again, the insurance plan, trying to be a good neighbor, lent us money, but last year we had to pay it back. And then also we participated in the FICA withhold. So for the year of 2021, we didn't pay the federal government our FICA taxes. So last year we paid them $1.14 billion. And actually, we still owe them another $1.14 million. So last year, we paid back $11 million in loans we had received from COVID. Other factors for that during 2020, you may remember that we weren't doing elective procedures, right? So the state sent out a mandate, we couldn't do that. By not doing elective procedures, millions of dollars of revenue that could have been earned by the district was not. So for the year 2020, from operations, the districts had a shortfall of $9 million from operating, and the next year, a shortfall of $4 million from not being able to operate, plus having the cost of the registry. So a lot of reasons we're not getting the funding we should. And then in addition to that, what's in the current year is we're experiencing inflation that hasn't been seen in 40 years. There's no way to predict that. When we do annual budgets, we have a certain amount of income we can raise, not through prices, but maybe through volume assumptions, because the federal government, the state government, 75% of our clients, they set the reimbursement rate. So regardless of what the district charges for a service, and regardless of what anyone else charges, the government, the federal government, the state government still determines what you're going to be reimbursed for that service. Under critical access, at least Medicare counts our cost for that service. Under Medi-Cal, the state does not count the cost of that service in most areas. So a study from Kaufman Hall showed labor expenses since 2019 going up 16%, pharmaceutical costs 41%, and medical supply costs 19%. So double-digit inflation. In addition to the cost of providing care, the state also, if you will, legislates unfunded mandates. So they're telling hospitals, this is something you have to fund. Probably seismic compliance is the one you hear the most. We have to bring our buildings to code by 2030. In addition to that, there were some programs, unfunded mandates for COVID. So we had to start providing sick time to all of our employees because of COVID. Lastly, I'll mention, and this happens year after year for the funding, we provide millions of dollars of care for the underserved. So charity care, non-payment care, just because not everyone gets on Medi-Cal. There's a process to sign up. You have to be approved by the state. If you're not approved by the state, then you fall into what we call self-pay care. And in some areas, you don't get Medi-Cal coverage, but you can get charity care or relief for care. So that adds a couple of millions of dollars for the district. That's common in the industry for people who provide uncompensated care. Another story I just read, the American Hospital Association stated half the hospitals in the U.S. for 2022 ran on negative margins. So the negative margin, what is the revenue you generate from your business, less the expenses? What's the percent that you actually get to keep? So when we say it's negative, you're not earning funding from your operations, you're actually losing money. So it's broad to talk about what's going on in the United States. Closer to home in California, the California Hospital Association, just for California, estimated California hospitals lost $12 billion. And that's after taking into consideration COVID funding. So the CARES Act funding and the American Rescue Plan funding was not enough to cover the losses many hospitals endured during that time period. Another question that comes up often is, well, maybe you're just in too much debt. You know, that's the problem, you borrow too much money. Actually, the last time we borrowed revenue bond money was 2013. And then in 2021, we refinanced that debt and saved $1.7 billion. As we speak today, we owe approximately $10 million in revenue bond debt. We have over $60 million of equipment and property assets for the district. So we're not very leveraged. Many of you in your property tax, in 2005, we had Measure L. That was refinanced by the county in 2014. So that comes through the property tax. There's about $24 million of debt for that. It built the emergency room, it built the women's center, and it did some other things at the hospital. That debt is a pass-through for the district. It's paid by us, the property tax owners. Another small debt I did file for and we were approved early last year was a CHFFA loan for the roof. Many people have asked, you borrowed $2 million for the roof. Well, I did because that roof is 60 years old. The current hospital is older than the previous hospital. So from 1907 to 1962, on Monterey, the hospital operated. This hospital is older than the previous hospital and was in need of repairs. So the government helped us borrow $2 million for the roof. If you've experienced the rain for the last 3 weeks, I can tell you the old roof would not have made it. And as a guide for that, in 2019, we had 2 failures. We had one with ICU, the roof leaking, and then also the skilled nursing facility across the street with funding. So borrowing the money for the roof was a good thing to do. As of today, at least our net assets, we are over $20 million in net assets. So that takes into consideration any liability we may have. So I think we're pretty good financial position. Again, this comes back to the timing of when the state is going to pay us. A little update on what's happening. You'll remember, some of you came to the meeting November 4th. We had a special meeting, so the board passed a resolution that authorized the administrative team, if needed, to file for Chapter 9. At that point, with so much money going back into Medicare, we didn't think, I didn't think, we could make it through December without some type of assistance. So the resolution came, and then it ended December 31st of 2022. So we've been working with the state, working with our elected officials, working with the government entities, and Mary's going to mention some of this in a few minutes, on finding ways to bring revenue into the district. And it's revenue that we've earned. With Medicare and Medi-Cal, our large settlements are always a year look back. So we provided the service to the community. We're waiting to be paid for it. The bulk of the money, or a large chunk of the money, comes from what's called supplemental payments. So although I took care of that patient last year, I'm not getting the extra money for seeing that patient until this year. In December, the WARN Act went out, just like with the board resolution. We're following the law. We're informing people on schedule when we're supposed to. And when that act went out, we thought we would only have enough cash to February 18th. So the notice was sent. We've worked hard since February 18th to bring in more funding.